Good evening, everyone. Thank you so much for joining us here tonight at 180 Strand. It's such a pleasure to see so many faces, both new and old, and Happy New Year. This is our first event of 2023, and so wonderful to be able to do it in such a gorgeous, inspiring, transporting venue. For those of you I've not met, I'm Francesca Okiman-White, and I'm the founder of the Beauty Triangle. So we're here tonight to talk about deep cleaning, because I think we can probably all agree January is a time where we all go into the year with the most well-intended sort of resolutions, but all too often those resolutions don't always stick. So really tonight we're going to be talking about the ways that we can really detoxify our bodies, affect positive change, and really lay the groundwork for the year ahead. Now, before we actually answer that question, a little bit of background about the Beauty Triangle. We set up TBT as a way to educate and empower our audiences, such as yourselves, on all aspects of their health and well-being, and crucially always from a holistic standpoint, which is why you'll always find 3 amazing practitioners on our panels that are all absolute specialists in the area that they practice in. But we also did it to connect you with the most expert, the most trusted voices in the world of wellness, and ensure that we're putting genuine and responsible information out there into the public domain. On that note, moving on to our amazing panelists, we're joined here tonight by some of London's finest practitioners, starting with aesthetic doctor, founder of the Taktouk Clinic, Dr. Wassim Taktouk, ophthalmic surgeon and oculoplastic surgeon, as well as co-founder of Face Restoration, Ms. Rachna Murthy. And finally, Remodelage expert and body therapist, the brilliant Julien De Richeville, who works here from 180, but also has his own clinics, which we'll find out about very soon. And really they're here to give us the most simple, straightforward steps, whether that's deep cleaning our complexions, restoring our microbiome, losing sort of water weight that we no longer ever want to carry, or just eliminating toxins. So real gold dust for this time of year. I'm going to stop talking now. I'm going to hand over to these guys. They're going to say a quick hello, and then we'll get cracking with the real conversation. So, Wassim, maybe you can kick off.
I'm Wassim. I'm a cosmetic doctor. I'm based in London. I founded the Taktouk Clinic, and we're 2 years old. I've been a doctor a lot longer than that, with a background in general practice and emergency medicine.
Thank you. Lovely to have you with us, Rachna.
Hi, I'm Rachna Murthy. I'm a consultant, as Fran said, oculoplastic surgeon, and I co-founded with my colleague here, Professor Jonathan Roos, Face Restoration, and we work in Harley Street and in Mayfair and in Cambridge. We do aesthetics for the face, as well as devices and surgery for everything around this area.
Thank you, Rachna. And finally, Julien.
So nice being here with you tonight. I'm Julien De Richeville, as Francesca said. I'm specializing in the more manual aspect of things. We do treatments that are designed to help detoxifying the skin tissues, tonifying them, draining, and also resculpting the silhouette. I've been doing that for 10 years. It's a family business founded in Paris by my mother 25 years ago, so here I am.
It's the chicest body sculpting treatment I think is out there. Anything that comes from Paris always is. So these are our amazing practitioners. Everyone's introduced themselves, but I'll get cracking with the first sort of amazing panelist, Dr. Wassim. He's introduced himself, founder of the Taktouk Clinic, one of the most sought-after injectors, trainers in London. Also, in my opinion, probably one of the nicest men working in aesthetics. So we're really delighted to have him here tonight. But Dr. Wassim, maybe you can start by telling us a little bit about, what happens when the patient first comes to see you? What's your first step?
I guess with our patient journey, the first thing that everyone gets is they are sent a very, very long questionnaire that makes the national census look like a postage stamp, with lots of very intrusive questions, generally to get an understanding of their medical background, medications that they're on, but plant in there a couple of specific questions just to make sure things are okay from a mental health point of view, make sure we've sort of addressed the psychology and the factors behind them coming in.
That's super interesting.
When they then come in, we subject them to many, many photographs, but before that we ask them to send in their own photographs, of which no one does that, no one. And then you get the occasional person who sends reels and albums of photographs, completely unnecessary, and always the inappropriate ones at the wedding day. And that's,
lol.
Yeah.
Why are you asking people to send in the photographs? Because you want to see them 5 years ago, 10 years
Yeah.
ago, or you want to see how they see themselves at their best?
For a few reasons. One, it's always nice to see where they feel that they look their best. That's important. But two, it's always good to have a starting point. I think that unfortunately, there are many practices available to patients, and sometimes they do cheat on us, and they do see several practitioners. Sometimes they can lose sight of where the starting point was, and sometimes it is quite good to sort of reel people back in sometimes and say, hey, listen, I think this is a step too far.
Yeah.
Let's go back to how you looked. I think, with what's going on. So sometimes it's important, not only for before and afters, but to also remind people of where the starting point was.
I think that's such a good point. And I know we're here to sort of talk about detoxification, but actually I think that's a really interesting element of what you do aesthetically, almost detoxifying the work that somebody may have already done. If they're stuck in a rut, if they've lost sight of, where they came from. You must have to have conversations with patients where you do have to sort of gently guide them back to a place of more responsible injecting, perhaps.
Absolutely, and I mean, we're all humans, we're all patients, we're all fallible. We're all just as easily can be fixated on one part of our face and not be able to look at the bigger picture. And to be louder, I shall speak louder. Sometimes we can be fixated on certain parts of our faces, and sometimes it does need someone to be a little bit more objective and guide you in the right way.
Yeah, so true. Going back right to the beginning, so the foundation of skin, like the skincare that you're using, are there any sort of particular products, ingredients that you recommend this time of year for a real January sort of deep clean?
Yes, I mean the deep
What is
clean,
your list?
Well, I think January is just the most horrific skin. So it's all dehydrated. It's had a sort of a couple of party nights over Christmas and New Year's. It's a bit dull, it's a bit pale, it's
drunk
dry.
way too much.
Yeah, far too much. So I think the first thing is trying to restore to some degree that luminosity and that radiance. And so there are several ingredients that I like to introduce generally at this time of year because there is no sun. I feel a bit safer bringing them into the picture.
Yeah.
So things like your alpha hydroxy acids. These are acids that are derived from fruits. Things like glycolic acid is quite a nice thing to be introducing at this time. It's great for resurfacing the skin very gently. It's not an aggressive exfoliant. And the idea being it helps the fine lines, it helps with collagen, it's an anti-inflammatory, and just give you that sort of vitality back into the skin.
I'm using the most amazing glycolic cleanser at the moment, and I swear it sort of like peels off so many layers of dead cells on the surface of my skin.
Yeah, it's really effective, and it's very well studied, and it's a very nice one for someone who hasn't ventured down the route of alpha hydroxy. So that's one of my top ones, I think, around this time of year.
Okay, nice. And what about sort of preventing, I suppose, the overstripping of the skin and really cultivating resilience? Because I feel like so many of us, we worry that our skin is looking dehydrated and dull, and then we try and throw everything in our bathroom cabinets at it this time of year.
Yeah, so it's a big problem. I think, lockdown itself made all of us into dermatologists because we were all watching TikTok, we were all watching Instagram, we were all learning about a new power ingredient.
Wildly qualified,
and we were all just piling it on. I mean,
Yeah.
the patients before and after were vastly different. Patients came in knowing everything, and but does that
So
have
true.
niacinamide now? How do you even know what that is? And I was quite floored, right? Like people just were so knowledgeable and piling this stuff on. But really, you can be destructive to your skin. You can overtreat it. And some of the things that we do can strip the very vital skin barriers. It has a protective function. It's important for epidermal water loss. It's important for keeping pathogens out. It's a barrier there for a reason. So I think it is important to also respect that. And think of ingredients like epidermal barriers, humectants, different things to hold the cells together, ceramides. I'm a big fan of triple lipid restore. It's a SkinCeuticals one which has ceramides, cholesterol, and fatty acids. If you think of your cells as sort of tiles, and the grout is the lipids around it, that's what you're losing. So you're reinstating all this lipid layer. And things like this triple lipid restore is very good at mimicking that.
You're such a master of metaphors. Love it.
Thank you.
And what about the products that you rate before an aesthetic procedure? Because you're obviously the sort of go-to guy for a lot of the injectables and the skin health boosting treatments. Is there anything that we can do from home, I suppose, to optimize those treatments?
Yeah, I mean, I don't think it's dissimilar to what you would do anyway, but certainly there are some non-negotiable things that have to be a part of your skincare. So antioxidants should be in your skin. Your skin has to be in the best possible condition, and it has to be very, very hydrated. When you use any of these lasers or energy-based devices, it works best through really cells that are filled with water and as hydrated as possible. So antioxidants are important. So your vitamin C's, your ferulics. Again, the triple lipids. Hyaluronic acid is important as well. That also serves as a humectant, keeping the moisture in. All of these things will help the energy transmit better through the skin. And all of these things would be continued afterwards as well. So CE ferulic, for example, has been shown to speed up the recovery time after a lot of the laser procedures that we do. So there are things that you would continue and hopefully continue into daily practice.
It's super
way
interesting.
After.
Also, it sort of really loans itself to that argument that the patient has to do everything within their power at home to support what you're doing in clinic. Otherwise, sort of what's the point?
Absolutely. We can do all we can to sort of almost reverse, or not necessarily reverse, to improve the current status. But you then have to do your bit as well.
Yeah.
I mean, there's no point investing. Some of these machines and these treatments can be quite expensive. And if you're not
so
going
true.
to do your bit as well, then there's not really much point in delving in them.
So past skincare and all the topical stuff we're doing, what are the treatments that, before you go in with things like toxin, filler, is there anything else you can be doing to really restore skin health?
Yeah, I mean, we're big consumers of skin boosters at the clinic. So, and we have a face menu. There are different brands that have different properties within the configurations. Some are formulated with hyaluronic acid and glycerin, some hyaluronic acid alone. Some will have sort of mesotherapy, amino acids, different skin nutrients that injecting into the skin will get them to where they need to be versus putting them on topically. So we do a fair bit of skin boosting in the lead up. So those are very popular for us.
So you're really looking at the patient, you're identifying their own sort of unique skin type, and then you're finding the skin booster that fits them.
Absolutely. There's no point in having any injectables or any of these treatments. For me, in my opinion, if your skin does not look as good as it can be.
Yeah, that's so true. And also the impact of the more invasive treatment, for want of a better word, is probably going to be better if your skin is in incredible condition.
100%.
You'll see the effects much more so.
And it will heal better.
Yeah, that's also true. Tell us a little bit about the treatments that are sort of, I suppose, making waves at the moment, because your clinic, and Dr. Wassim's clinic is in Knightsbridge. It's probably one of the most beautiful clinics I've ever been in. You feel like you're in your own sort of suite at Claridge's or something. It's very chic. But it also pioneers some amazing, very sort of revolutionary face-led treatments. So what is new? What's going on at the moment?
I mean, certainly for us, we're really excited right now about the cool peel laser that we have. So that's, we're sort of banging the drums on that a bit. And it's essentially, CO2 lasers were traditionally sort of
Terrifying.
high downtime, sort of you went in, sometimes put to sleep, and you came out and your face came off Freddy Krueger-esque, but you had wonderful baby skin by the end of it.
Is that Samantha from Sex and the City, like peeling off red, raw?
Yeah. And I just don't think any of us have that kind of downtime anymore. And certainly I would rather do 2 or 3 baby ones to get the same result and not really affect my social calendar than be put out for a fortnight, just not looking very pretty.
So why is it called the cool peel?
Because it's I don't know.
Sorry,
I was really thinking
that was
about
me throwing
that.
questions.
I don't know. I think it's to
it's cooler.
make it more akin to a peel, a gentle peel, versus an ablative, full-blown
fiery
treatment. But it's with CO2 laser, you have your skin and it kind of scoops the top layer of the skin, whereas with the cool peel, it creates these very laser-like channels, and it keeps all the skin in between them nice and healthy, so it just sticks together, and the healing time is much quicker.
God, it sounds amazing.
Yeah.
So what sort of benefit are you seeing from having that sort of treatment?
So it's going to do a lot of it's skin resurfacing mostly. So the tone of your skin, the texture of your skin, sun damage will be improved, fine lines, wrinkles, create a bit of tightening of the skin as well. It's pretty phenomenal, and I think with that kind of a downtime, I think it opens the door to people who are possibly a bit scared by the word laser.
That's so true.
And we say 3 to 7 days. Most of the patients that I've treated have been good to go by day 3. And when I say good to go, that they could have gone out at day 2 and maybe on some mineral makeup. So
exactly.
The downtime is really not a big deal.
You're right, people are very scared of laser if they've never had it before.
Absolutely.
And it's a shame because it's got such a bad rep, probably from things like Sex and the City in all honesty, but it really does sort of downplay how amazing the results can be if you have it in the right hands, obviously. You're also doing something quite unique at the Taktouk Clinic, which is that you're really cultivating a very sort of almost old school GP style clinic. You've got amazing specialists all under one roof. So for example, I think you've got Dr. Christine Hall, who does amazing Korean skincare. You've got Professor Faraz Al-Naimi, who is an incredible dermatologist. How do those other professionals all fit into that sort of patient skincare detoxification journey?
I mean, I think we're all united in our ethos that it's ethical, transparent, results-driven treatments. But I think we all have different interests as well that kind of come together very nicely. So Professor Faraz is the king of lasers. There is nothing this man doesn't know.
It's quite
he's still
terrifying
teaching
to
me
listen to
every
him
single
talk.
day. I'm learning something. I'm like writing it down. And you have Dr. Christine, who is an exceptional. She's a fountain of knowledge. She's by background a pharmacist before she did any of the medicine side of things. So her knowledge of ingredients and skincare, and she's in the audience. I'm going to point her out just so everyone can wave and embarrass her. Raise your hand. No, I'm kidding, I'm joking.
Who makes you present next?
Who does extraordinary skin consultations, and if you won't mind me saying that Christine's had suffered with her skin in the past, and so has that real experience of turning your skin around in its entirety. And I think that that first-hand knowledge and experience, it allows you to really be a bit more empathetic with your patients. And I just do mostly injectables really, but I do have an interest in laser and the skin. I think between the 3 of us, our qualities, I think, work quite well.
the dream team.
Yeah.
And finally, what can we all do, I suppose, from home to cultivate really strong, healthy skin at this time of year?
I think with anything, it's consistency, right? So
Yeah,
one of the
so
things
true.
that we do with our patients is we say, bring in your skincare. Don't tell me what you actually use. Bring in a bag of your skincare, because half the time, they don't do half. It's like me when I say I do Pilates. I go once every 6 months. So the reality is you can sit there and say all the power words to me, vitamin C, and that.
Yeah.
Bring me the bag and let me go through it. 'Cause
I will
half
be the
time-
judge of your skincare
yeah,
routine.
It's true, but sometimes they're putting the vitamin C's on at night or the rest on the day. So even the most basic things are out of whack. So
Yeah.
I think getting it in the right order, understanding it, and enjoying it. So if you put some time towards your skincare, you will get the results. The results will spur you on to keep doing it. So we don't like to overload them, but also there's got to be enough in there to create a result. And you start enjoying your skincare and you make time for it. So for me, it's consistency, the right ingredients, always revisiting your skin, having regular consultations about it. Just because something works now, 6 months down the line, your skin may have improved, there may be something better, something that needs to be increased.
Yeah.
So always have recurrent consultations and pop and see the practitioner. Things change. So I think I'm sorry, it's a very boring answer, but it's consistency and using the right ingredients.
No, I completely agree. It's like whenever someone says to me, sort of, what's the one thing you should always use? And I say, I know it's boring, but it's SPF. And it's using these ingredients every single day. You know, there is no silver bullet to actually suddenly looking, you know, incredibly healthy in January. You actually have to sadly build that and cultivate that over a little bit of time, don't you?
100%. I mean, the non-negotiables, your antioxidants, your SPF, quite
Yeah.
rightly. And then, you know, if you want to go down the retinol route, that's a separate conversation. But I always recommend you speak to a doctor about that before starting. But those three together have proven clinical results and improve your skin. So they should be the basis of everything else. And then everything else can be added and targeted to a specific skin concern.
Yeah, and all of your injectables are then the icing on the cake and,
Yes.
your cool
Which is
peel
what I do, by the way. I do,
laser.
so the injectables, yes. Back to me. So yes, I do injectables
No,
too.
you're wonderful. Perfect. Well, thank you so much, Wassim. It's
Thank
always
you.
a joy talking to you. And
Thank
any
you.
questions you have for Dr. Wassim, we'll have an audience Q&A. I didn't say that at the beginning. I'm so sorry. We have an audience Q&A, so please save any questions towards the end, and we'll definitely answer those. So yeah, we'll come to that all later. Our next amazing speaker is Miss Rachna Murthy. She introduced herself already, ophthalmic and oculoplastic surgeon, one half of the amazing face restoration. She has a really unique way in not only delivering her very beautiful blepharoplasties, eyelid surgeries, but in addressing overall eye health and incredibly holistic. So firstly, thank you for joining us, Rachna. Maybe you can start by telling us a little bit about, I suppose, how eye health is construed today. We're always talking about skin health, how important that is, but you obviously see it from, well, through your own eyes. Sorry, forgive the pun, but why is eye health so important right now?
Yeah, I mean, I'm obviously very biased because this is an area that I specialise in, but when we're speaking to people, and I'm speaking to you, we communicate with our eyes. So it's really, we communicate with our eyes and our voices. So I'll try and project, so please let me know if you can't hear me. But the eyes are really important for communication. So any change in the eye area can affect our perceived emotion. So
true.
Someone can go from looking very fresh and refreshed, and then this area starts to age, and you can start to look tired, you can start to look angry with the frown lines, and it really affects the way people feel, not just the way people look. And so to go on from that, anything that we do around the eye area will also impact on expressed emotion. So, you know, the skincare that we use around our face may be relevant for the rest of the face, but actually the skin around the eye area is very different from the skin in the rest of the face.
It's so much thinner as well, isn't it? It's only a few skin cells
half a
thick,
millimetre,
apparently.
half a millimetre
It's crazy.
thick. And so skin elsewhere is 1.5 millimetres, which doesn't sound like a lot more, but it makes a big difference. There's no fat underneath the skin in the eyelid, so you're directly onto the muscle. And so all the things that we do around this area to the face with skincare, with energy devices, may not be appropriate for doing around the eye area. So it's really important that we have to respect our eyes when we do anything. Our lifestyle choices, our makeup, where we live, it can all impact on the eye area. So it's a really important part. And it's also important for vision. So any, you know, it's a cliche, it's the window to the soul, but it's also how you see. And so if we do anything around the eyelids, it affects the tear film and the eye surface. the eyes can be dry. That has a significant impact on how you see.
Yeah.
So, we've woken up in the morning and our eyes are a little bit blurry, but if you've had a night out and you're a bit dehydrated, your eyes are going to be even more blurry because your eyes are very dry.
So true.
And that gets worse and worse as we get older. And so the vision's also an important aspect.
Yeah, I think with anything we speak about cosmetically, we always have to remember ultimately underlying all of that is a functional role for most of these things that we're talking about as well.
And
Skin,
the
eyes,
aesthetic will
body.
impact the function, and
Yeah.
it's also the most sensitive part of the body. So you've got the most number of nerves in the clear window, the cornea. So again, if you've rubbed your eye or you've got something in the eye, it's the most painful thing. And so it's really important to look after
That's
the
me
eyes.
constantly rubbing my eyes. It's like, you can always tell when I really need to go to bed. It's just constant eye rubbing. On that note, do you find that people are more and more suffering with the allergies, with the sort of sensitivities to the eye area now?
I think it just depends on where we live, and if you live in London and you're surrounded by pollutants, yes, you may well be. If you live in the countryside, you may be affected by hay fever and the allergies due to that. But I think more and more we are seeing people as eye doctors. We're seeing people who come to us with eye sensitivities and dry eyes. And one of the important questions that we ask is, what are you actually using around your eyes? What are you doing in terms of eye makeup, for instance?
It's these things you're using every day that are probably
there are things
consistently
that
building
we
up.
are using, we take for granted.
Yeah.
For a long time, as eye doctors, we were telling people to clean their eyelashes with baby shampoo. And
Wow.
Johnson's baby shampoo was the brand that we would recommend.
Isn't that the stuff that goes in your eyes as a child and you cry?
Well, exactly, but that was also the stuff that contained formaldehyde for a long time. So
Yeah.
there are lots of ingredients in these products, like shampoos and skincare, that we don't really regulate. And in the EU, there's much more regulation than there was in the US. So I think there's something like over 13,000 chemicals that we know about, and only 11 of them are regulated or banned in the US, and
Wow.
slightly more than that in the EU. So we've got some regulation, but not very much.
Yeah, exactly.
And it's because it has to be really toxic and really nasty before it's going to be banned. But quantities that are in lots of things we use can be impacting on our eyes, and that can cause sensitivities and can cause much worse things as well.
Yeah, if left unchecked. And what about things like the microbiome? I feel like we often talk about this when it comes to the skin. Is it something that also is applicable to the eyes as a concept?
Yeah, so we talk about microbiome. It's a real buzzword, and I think, Wassim, you talked about the sort of lipid barrier. So our gut and our skin are the biggest sort of barriers for organisms, for pathogens, for diseases getting in. And our skin is protected by a microbiome. So a microbiome is basically a colony of organisms. So that could be bacteria, viruses. Yes, it sounds awful. We might all have mites all over our body. We probably do. And it's normal because they protect us.
Friendly mites.
Friendly mites. So don't go out thinking they've got mites all over your body. That's probably not right. But we have a friendly army that protects us.
Yeah.
And it protects our eyes, it protects our eyelids, our eyelashes, the rest of the skin. And so all the things that we can that we do to ourselves with skincare and surgery and energy devices, all of those things will affect the microbiome. And that can mean that we introduce bacteria, and there's a risk of infection that can lead to inflammation and swelling, and that can lead to diseases. And so it can become a vicious cycle. So the microbiome is important because we want to be looking into protecting it. And we're talking about detox and toxins, and if we do things that damage the microbiome, we're actually getting rid of the army that's also already detoxing ourselves. So we need to be thinking about looking after the microbiome. And actually, in your goodie bags, if you don't know, if you haven't been to these events before, you get a wonderful goodie bag, and we have got a product in there which is really important for microbiome protection.
Is this your purifiers?
Am I allowed to talk about that?
Please, yes.
About 5 years ago, we approached a company that was making a product for skin care in aesthetics. So Cleansept is a product that you might know about if you're
They
working
clean
in,
your face before
clean your
injectables.
face. And there's a need for something to be able to use around the eye area because the eyes are very, very much more sensitive. So we work with this company to develop and patent a product which can be sprayed directly onto the eyes, the eyelashes, with contact lenses, and it looks after the microbiome. So It's an antibacterial, antiviral, and it's a great product, and you've got it in your bag, so you do feel free to use it. You can spray it in lots of places other than the eyes, although it's marketed just for the eyes, and it's called Purifies. But it looks after the microbiome. So every time you're using mascara or eyeliner, or you're taking it off with a strong alcohol-containing makeup remover, you're stripping your eyelids and your skin around the eyes of the microbiome.
Yeah, and all of those sort of probably natural oils that you need to keep things sort of nice and healthy and nourished.
Yeah, so it's really helpful to be looking after this area and the rest of your face with something that is gentle and something that's not going to damage your microbiome, that's going to reset it. And so that's a product that's in your goodie bag you can try.
So products aside, what are the sort of, before we talk about things like the blepharoplasties and the surgery, are there any sort of non-surgical treatments, I suppose, that can be really restoring eye health or microbiome or just helping us to have healthy vision?
So as you said, Jonathan and I are very holistic, and we work together as a team as well, which is quite unique in terms of surgery. And we want to bring in new, innovative, safe technology. And the other thing that we stumbled upon, or not stumbled upon actually, we were actively seeking out is something called Optilight, which is an intense pulse light, but it's a very special intense pulse light because it can be used very safely around the eye area, and it's able to kill off some of these mites that we talked about, the Demodex mites. It's able to treat inflammation around the eye area. And with the right settings, it's able to treat rosacea in the face. And so I don't know whether, hands up, how many people have heard of rosacea? It's about 1 in 10 people have rosacea, which is quite a lot. You know, a lot of us, we may not even see it, but a lot of us...
A lot of the time it's underlying, isn't it?
Yeah,
and you might not even know until it's revealed on one of those very scary sort of Visia scanners or something.
Exactly, and very often it gets worse and worse as we get older, and in some men in particular, you might see sort of enlarged blood vessels on the nose, and it becomes more apparent. And that rosacea, 1 in 10 of us have rosacea. 80% of people with rosacea will have some problem with their eyes related to the rosacea, because that inflammation extends to the eyelids.
So that's the link between rosacea and the sort of dryness in the eyes,
Absolutely,
is it?
because the oil component of the tear film that's produced by the oil glands around the eyelids are affected by inflammation from the dilated blood vessels in the cheek and in the eyelid. And so what's great about this machine, the Optilight machine, is that we're able to use a light treatment. So it's not even burning. It's a intense pulse light that's very selective for the blood vessels in the cheek, blood vessels in the eyelid, and it's very gentle.
Yeah.
We have to do a course of treatments, but it's able to reduce inflammation. It's able to speed up our surgical recovery time. So we aim for sort of scarless, minimal redness after surgery. And so it's something that we've brought in order to improve the care around this area.
That's really interesting. So actually, again, you're using those sort of non-surgical devices to enhance the outcome of your surgical procedures as well.
I think it's really important as surgeons not to just use the scalpel, or not to just use sort of things to cut and stitch. We really have to take people as a whole and use all the new things that are safe, and injectables. You know, we do injectables as well, and so there's an absolute role for all of it in the right places. And
what I like about your technique as well at Face Restoration, I think you've thought very long and hard about how to really emphasize that patient journey and really make it very calming. And I think, again, that's really important if you're trying to achieve a really positive outcome, is that you really identify what those triggers that are going to sort of cause disruption might, what they might be, and actually you do things to sort of calm them, don't you?
I mean, we love operating and we love surgery, but surgery is very scary for people. The idea of having an operation is oh my goodness, I'd rather have a treatment, I'd rather have something that's quick and gentle in office, and I'm in out, I don't want to go around bruised for ages. I want to be able to carry on with my life. And so
particularly when it comes to the eyes, it's, you
eyes.
can't always hide behind massive dark sunglasses.
You can't hide behind a mask.
Like an idiot after a while.
That's the bit we've all been focusing on for the last since COVID.
Yeah.
And so our holy grail has been to produce the minimum downtime surgery. Okay, for want of a better word, it's still an operation. Minimum downtime, quickest recovery, and no scar. That's our holy grail.
Yeah.
And I think we're getting closer and closer to that because we've brought in lots of technologies, and also because we work as a team.
Yeah.
So we've got two, and Jonathan's sitting there really quietly. He didn't want me to mention him at the front at all, but it's teamwork.
Yeah.
And teamwork is how we get great patient experiences because you have a built-in second opinion.
Yeah.
It seems that it's really unusual to have two surgeons working together, and why do we need two surgeons to operate on eyes? And we've got some of our patients here without giving away any patient confidentiality. But I think from the patient point of view, it's really lovely to be looked after, and you're not paying twice the price. It's a quicker operation, but we spend the time that we need to do the operation.
Yeah.
We do all of it under local anaesthetic. So
And that's something that people worry about, isn't it? The sort of general anaesthetic, what that does to your body. I think the local is a lighter, sort of more appetising.
It's great. I mean, if you have an injectable, actually that could hurt more than, although we try not to make our injectables
unless you have it with Wassim and then they're pain-free.
Especially, not Wassim's injectables, not our injectables, but it can be very uncomfortable and have any filler in your lips or that kind of thing. You know it's painful. And this is a sensitive area, so we want to make things pain-free. So we use the finest needles around. We have aromatherapy. We have lots of little tricks up our sleeve. We have minimised the bruising, so our recovery from upper lid blepharoplasty. So that's probably blepharoplasty. The word is for surgery around the eyes, but that's our bread and butter. So upper lid, hooding, under eye bags, dark circles, and we have improved the recovery so that you can have a recovery within a few days for upper lid surgery.
Right.
Lower lid surgery maybe within a week. Or for eyelids takes a little bit longer because then you affect the lymphatics and it does a little bit more swelling. But people get back to work within the day or
that's phenomenal.
a couple of days. So.
And what about things like the use of ultrasound before you go in and do your surgeries? Like, do you see any virtue in sort of detoxifying the eye area, trying to get rid of any old filler that's in there? I feel like it's quite topical at the moment.
Yeah.
How long filler actually does last? I mean, Wassim's also a good one to ask about this.
Yeah, that's a really good question, and it's very topical, and I think people do things very differently. So a lot of surgeons will say, we need to find out if you've had, where the filler is, if you've had it, if it's near the eyes, we need to dissolve it, you need to look very hollow and saggy for whatever.
I guess they want to
2
start
weeks.
with a blank canvas.
We'll start with a blank canvas, but actually it's not a blank canvas because you change things when you dissolve things.
Right.
The enzyme that dissolves fillers, called hyaluronidase, is something that's naturally occurring in our bodies, and we're full of hyaluronic acid ourselves. All our cells are full of hyaluronic acid. This eye area, the eyeballs are full of hyaluronic acid, and we're naturally born without much of that enzyme in that area. So if you suddenly inject a whole load of dissolving enzyme to get rid of any filler in that area, you end up with, getting rid of some of the filler, but you also end up with creepy skin because you're dissolving some of that sort of really thin skin as well. And so that's very hard to treat with surgery.
Yeah. And it might be also quite traumatic, I suppose, for the patient as well, if you're used to seeing yourself with a certain amount of product around your eyes, and then suddenly it's very sort of, the skin's crepey, like you say. It can be quite demoralising.
From our point of view, there is no indication to remove any filler before any surgery.
Right. As long as it's obviously not providing an obstruction, you don't need to.
It shouldn't provide any obstruction. If filler's there and it's blocking lymphatic channels, and we do surgery, you can have more swelling.
Yeah.
But we have ways of dealing with that to improve the lymphatics. And you can't get rid of all of the filler because you can't target all of the filler. Some of it's actually engulfed into the muscle, it's integrated, some of it's migrated.
Yeah, that's true.
Some of you will have seen the Daily Mail article which shows that filler's been there for 2 decades in Alice Hart Davis, who's another journalist, and in her face. And filler does last a long time. But interestingly, she had her temples injected and there was nothing shown in the temples. And so I don't think an ultrasound, which is quite crude compared to an MRI, is going to be adding that much extra information. So from our point of view, we never ultrasound. We do our surgery, we get great results regardless.
Yeah.
And we preempt the fact that there might be a little bit more swelling in their surgery.
Fine. And final question, Rachna, what can all of us do sort of from home, I suppose, to preserve eye health in the long term and to really sort of optimise this sort of upper third of the face?
Yeah, I mean, I think the first thing is to try and go back to the detoxing thing, try and take away some of the toxic things that we are doing around this area. So if you're using lash serums, for instance, there are some lash serums that contain this thing called prostaglandin, and prostaglandin is a glaucoma treatment, and it causes atrophy around the fat around the eyes.
Wow.
It makes your eyelashes grow longer, but it also can affect the microbiome. And so switching out things that could be toxic, We have Amy who's here, and she's also provided a wonderful product for the goodie bag. And so Amy Gallant-Sullivan is the CEO of Esri Labs, and she's made this eye safe opto-cosmetic range, which has got eye safe cleansers and skin wipes and eyelid wipes, and also eyeliners and eye makeups. For those people who have really bad dry eyes and they can't wear makeup at all, this is revolutionary. And so there's an eyeliner in there. But
That's incredible.
so yeah, change your makeup regularly. So mascara, things like that. Don't share it with other people. Every 3 months you probably should change it. There may be some formaldehyde in some of the products that you're using. Particularly US brands may not be as well regulated as the EU brands.
Yeah.
Look after your microbiome. Consider taking supplements or have a healthy diet. You know, there are certain supplements that are quite good for eye health. So things like sea buckthorn, omega-2s,
Yeah,
omega-6. They're quite good for the lipids in the skin as well as the eye area. Avoid smoking and avoid drinking. All of those things.
All of those fun things that are keeping us going in January.
Yeah.
Yeah, exercise, all of those things. But yeah, just be careful and gentle around the eye area.
Amazing. Well, thank you, Rachna. That was super interesting, and yeah, really good to know about all of the sort of toxins in the eye makeup. I think that's definitely one to take away. And thank you so much for joining us. Our final speaker is Julien De Richeville. He's not exactly the creator. Julien's mother is the creator of Remodelage, which is the most phenomenal sort of hands-on body massage, which I think you really aptly describe as tough love, which I love personally.
That's exactly what it is.
You need to tell us all about it, but firstly, maybe you can just start by telling us a little bit about the women and potentially the men actually who come to see you for Remodelage, and I suppose what they're concerned about, why they're coming to see you.
There are multiple reasons why people come, and depending on the time of their life, they realize we exist and decide to come. It might be just a case of after pregnancy. Sorry,
we'll try and speak louder.
my Frenchness. So it might be a case of I'm at just an after pregnancy point, like you recently did.
Yeah.
And I don't feel my skin tone is coming back at the stomach level. It might be a case of I have swollen legs, I have cellulitis, and I need something. I haven't found anything that really helps with it. And generally, it's a case also of I just want to feel better in my body, basically.
Yeah,
so it's,
exactly.
It comes at any stage of anyone's life, and it works for men as for women.
And I think you're right, it's about sort of putting the confidence back in as well. I mean, I saw Julien for a big course of Remodelage after I had my baby, and it was interesting because when you're breastfeeding, obviously you can't do a lot of these amazing energy-based device body treatments that everyone kept trying to throw at me, but I was able to do your treatment, which was phenomenal. And I'd say one of the main takeaways for me was how much confidence it gave me back in my body and its ability to heal and repair itself.
Yeah, clearly the point is to say that, of course, the skin and the body generally has a pretty strong immune system and has capabilities to regenerate to a certain extent, obviously. But if stimulated properly, you can help the skin to restore itself. And the fact that the manual treatments, what they offer to our clients, is that kind of reconnection that you get to your body as well, because very often we forget about it until the time you come onto our bed, and that's what the tough love part is about, is that the first sessions are not very pleasant, but they're just meant to remind you that there is inflammation here or there in your body, and that's where the bit of pain comes from. And just the fact of realizing that and seeing it dissolve and slowly getting back to normal makes you realize, as you were saying, that your body can heal itself pretty well if, again,
I mean, the body's ability to heal is amazing. Why is it that some of those areas, it's always like around the knees and like the ankles, it's a bit painful. Why is that?
So, I mean, all our theories rely on the fact that movement is the key, basically, and I'm talking about inner movement, circulatory movement, and areas where our lives make us lack of movement. So for most of us, we're sitting behind the desk a long part of our lives. And the fact that some areas are less vascularized than others, like joints, for example, that creates room for more swelling or more retention. And the gravity also doesn't help, basically. So more you go towards the ankle, and you've probably experienced it yourselves when you fly. That tends to expand towards the extremities, basically. So the whole idea of our treatments is to basically drain away all these excesses of liquid, but also by really kneading the skin tissues to help release all the toxic loads that's sitting in the fatty tissues, basically. All the toxins, they are lipophiles, and they tend to find a nice nest in the fat tissues, and our idea is just to work on that and try to soften these fat tissues slowly and restore some microcirculation within it so that you can drain away and that your inner functions will do the job of cleaning it out and again, having a skin looking nice from the inside and being properly fed is as important as protecting it from the outside, basically.
It's so true. Also, I think whatever we're talking about, whether it's like blood circulation, whether it's energy, whether it's chi, you know, different practitioners speak about this sort of like flow of energy through the body in different ways. And I think it's a really interesting point what you're doing. You know, I do think it actually works on a physical and an emotional level in many ways, what you do.
Well, I mean, the whole procedure is working on the entirety of the body. So we'll start working with the stomach, where a lot of people tend to harbor their tensions, and that's kind of a reflection of how we feel psychologically and mentally. Our stomach can't lie, basically. So when we start working and pressing a little bit, you can feel that people are like,
But so many people also aren't accustomed to having an abdominal massage. Like, it's a really popular thing in, you know, Asian therapies, but for a lot of people, you know, people are like, what, why are you touching my stomach?
But at the end of the day, I mean, of course, when you were pregnant, we were not touching that area, but at the end of the day, it's kind of the engine of your body. So as you were mentioning earlier, the guts are like a barrier to pathogens, and if the flow is not working properly, these pathogens or these toxins, as we call them, they will sit for too long in your guts, basically. So the idea and why we do spend a lot of time massaging the stomach is just to help with the flow, basically. And everyone has a different interpretation of what energy is, but as you were saying, energy is something that's flowing in your body. It can be emotional, it can be, your bloodstream is a form of energy, if you want it. So the idea is just, put everything into function again, put everything into movement, and try to also make people realize that they don't, as stupidly as it can sound, but they don't breathe properly, they don't use their diaphragm, and that also creates sort of blocking pattern to your guts and doesn't help with your digestive function. So that's always the first advice I would give to any clients. Start breathing, using your diaphragm, push it down and create movement in your guts, and there's an instant feeling of relaxation that comes with it, and long term it will help having guts less inflamed. Basically, when you press on your stomach and you feel that it's painful, that's not a good sign, so you should do something about it. And we're here to help, but you can help yourselves. But if you press properly, like as in deeply, and go down to the intestines.
Julian's tough love technique.
Exactly.
You'll feel something. Whenever somebody talks about deep breathing, I'm always like, I really deep breathe.
Yeah.
But it's important, isn't it? Because I guess you need the client to be in a sort of state where they are receptive to these changes as well. Like we all carry so much tension, and we go about our daily lives holding on to so much. And I think an hour or 50 minutes spent on your treatment table is an opportunity to let go of a lot physically and emotionally. Yeah,
totally. And again, that's to reconnect to yourself, basically. Realize that these small pains, they're evitable. They're not necessary to your daily life. And just understanding better how your body functions and what's at stake when you're tense, where your shoulders are tense, when your stomach is tense again, and what it creates inside in terms of inflammation. It helps living differently, relaxing your posture, again, breathing better. Also, what you eat is as important as the rest, because of course that's where the nutrients come from, and that's what's spreading around your body. So basically, you got to take all of this into account. Take care of your circulation, because again, you're crossing your legs, but that's another piece of advice I give to my clients. Stop crossing your legs, because it will block the flow behind the knees, all these kind of things. But
I need to not
just
cross my legs. I
it's
did
not
one of
like
these talks once, and I stood up and could barely
as
stand
Francesca
again.
was saying earlier, there's not like one magic answer to these little problems we build in ourselves, but it's a general way of doing things that we improve little things little by little, and everything will function better.
Yeah.
And the skin also reflects that. It's just
Yeah, that's so true. Are you working on the fascia when you do this technique as much, or is it more the sort of separation of the fat and the sort of toxins?
So basically the movement we use, and which is very specific to our method, aims at digging down to the deepest layer of the skin. So indeed, down to the fascia, basically, which is the envelope around the muscles. So the idea is, to kind of, the word is probably not really appropriate, but to unstick basically the fat tissues from the fascia and to try to release all these things that we tend to stock and that create, again, inflammations that can build up into muscular pain, that can build up into just, again, sometimes clients come, the first time you just press on the leg and it's painful, and it shouldn't be. And that's what most magazines or people call cellulite, but it's actually the inflammation of the skin tissue, because all these fatty deposits you have in the skin, they've stocked toxins, and that's why I was really happy to come and talk about it, because detoxification is not only by drinking green juices, it's also by working on your skin as it's an organ, basically. It's the biggest organ of your body. So treat it as you would treat the rest of your, and it's not, again, not limited to the face.
Yeah, you can do it for the face as well, right? The remodelage
we have
concept.
a facial protocol, which complements pretty well with what you guys do, because again, you feed the skin from the outside, but also you want things to breathe. So drain around the eyelids and around the eyes, work on the neck, and the idea is that it works. It's the same functions in the body than on the face. It's not like the skin is made of the same cells, and so that's the whole.
A billion muscles and things that we probably need to be exercising more. That's so true.
Where do I sign?
Julian works from upstairs. If I didn't say to anyone, his treatment table is ready.
I'm taking bookings right now.
What about sort of the at home? I'm thinking of things like body brushing. I mean, you just spoke about the skin being the largest organ. Is there anything that we can do in between remodelage sessions, or even before we jump on the treatment table upstairs, to actually stimulate the skin to get that detoxification process actually working properly?
I think you both mentioned it earlier. It's like being constant in your efforts, basically. And so you said dry brushing is one option. The idea is that it stimulates the micro circulation at the top skin level, but it also gets rid of the dead skin, if I may put it like that.
Yeah, it makes everything feel nice and smooth.
And it's a good procedure before applying any skincare. But again, more so moving as well. As stupid as it sounds, but it's not doing 1 hour of gym every other day that will compensate for the 10 hours you spend sitting behind your desk. So try to stand up most of your days, like every half hour you do like some steps. And it can sound undoable, but that's actually what your legs need to bring the blood flow back upstream.
Get one of those treadmills attached to your desk.
Exactly.
That's my dream.
Stand-up desk and a treadmill, perfect.
Next house.
Again, there's no miracle thing. It's just to think about movement all the time. And if you feel that you can't move, that's one thing. It can sound like a grandmother's advice, but compression tights, for example, they prevent the liquids from staying at the bottom of your legs. And if you feel you can't move enough, that's a good helper.
I lived in those when I was pregnant, really unsexily.
Yeah, but I mean, they do the trick, so
yeah, exactly.
You want to be happily showing your legs when summer comes. And
to be honest, no one's going to see them in winter, are they?
Exactly.
You'd be wearing them right now. You wouldn't know.
Exactly. But yeah, movement. For me, that's the word.
That's the key,
That's all about it.
That's so true. Thank you so much, Julien. Super interesting.
Very welcome.
That wraps up our discussion. We do have time for an audience Q&A. I also forgot to say right at the beginning that you should have hopefully found a program with information on all of our speakers tonight, and also a referral card. So if you'd like us to connect you with anyone that you heard speak here tonight, just please leave your email for us, tick the box next to their name, or all of their names, they're all fabulous, and we'll connect you after the event. And then, the goodie bag. I mean, Rachna spoke about it as well. I am not lying when I say it's literally the best goodie bag we have ever put together. Thanks in part go to Wassim for filling it right to the brim for us with amazing goodies and everyone else. But I don't need to remind you to collect one of those. We've got some stuff from SkinCeuticals in there really generously. We've got stuff from Ren, Advanced Nutrition Program. Eyes are the secret and purifies, so it's a real treat, a goodie bag, so to speak. Were there?
May I say a few words just about what's in the goodie
Please,
bag?
absolutely, because you
Sorry.
mentioned a few
Yes,
things.
I did.
and
I
kept
touched on it. So I touched earlier on glycolic acid and alpha hydroxy acid and being very good to gently exfoliate the skin. So you have inside from SkinCeuticals the glycolic 10 Renew, which is a cream that you'll apply on initially very gently. But over the next 8 weeks, if you do it consistently, you're going to see quite a transformation of your skin. It's going to be 40% brighter and clearer. So that's a really, really beautiful product that's in there. It's very gentle alpha hydroxy acid. There's that in there. 2 more, sorry. And then we have from Ren, there is a plum. It's their newest one. I think it was just launched last week, so you're one of the first to have it. But it's a hyaluronic acid with some biofermented probiotics in there as well. So that's good for your skin microbiome. And finally, from Advanced Nutrition, they have, and I'm going to get the name wrong, but it was a Skin Youth Bio.
Yes, Skin Youth
and
Bio.
it's a very beautiful blend of, I don't know how bacteria can be beautiful, but it's a good blend.
Like the friendly
it's actually
mites.
revolting, yeah. But good bacteria for
Beautiful
your
bacteria.
skin, which you would take as a daily supplement, and that's going to benefit your skin microbiome, and that is all. Thank you.
Thank you, Wassim. Yeah, definitely the biggest bag, so I hope you pick up one of those on your way out. Did we have any questions in the audience? If you do, please throw up your hand and I'll try and find you. This lady in the front here.
Hi, Eleanor. I'm a second nurse. I wanted to ask you, Sam and Rachna, in terms of detoxification, what kind of recommendations would you make for your patients prior to invasive procedures that probably rely on tissue healing or collagen stimulation? You know, obviously, say stop smoking, don't drink, but is there anything specifically that you would recommend prior, like kind of supplementations and things like that?
For surgical procedures, or
No, just anything. So things that are reliant on your body stimulating.
yeah, I think it's, again, we touched on it. It's the gut-skin axis, and trying to having good bacteria, good microbiome in your gut involves use of prebiotics, probiotics. So that's always very handy. There's a very strong relationship between your skin, how it heals, how it performs, its barrier function, and your gut. So if you're, I guess, paying attention to that and feeding it the right things, then yeah, you will have a better chance of recovery.
Rachna, did you have anything to add?
I think if people are going to be having energy-based devices that are ablative, then you'd want to stop the retinols. That's the only sort of safety thing. In terms of, as Wassim said, in terms of the internal health, if they're having a healthy diet and then they've stopped smoking, we don't like smoking for surgery because it delays healing. And so those are the 2 important things. But you can supplement, of course, and you can spend a lot of money on supplements. So there is SkinAid MD that is said to improve surgical results. Having said that, we know we have very good recovery in this area, so it's not essential, but healthy
I
diet
guess the
would be
skin
good.
and the eyes and subsequently the face does heal very well in comparison to the rest of the body, doesn't it?
Yeah, it does. I think some parts of the skin in the lower part of the body are more prone to scarring. The skin in the eye area has a different origin to skin elsewhere, as does the fat. So that goes into a whole different kind of talk, but which we haven't really got the scope for here. But it does heal very well, and if it's treated well, then you don't need to be having particular supplements or doing anything different.
Okay. Were there any other questions? If not, I'm sure if anyone has anything they want to quickly ask our amazing speakers at the end, they will be delighted to chat to you. Otherwise, all that's left for me to say is a big thank you to our amazing panelists. They were super inspiring, really interesting, and yeah, a huge thank you from me for being here. And of course, thank you to all of you as well for coming tonight. It's such a joy to see you all, and please come to all of our events. We'll have another one signposted very, very shortly for February. We'll have one every month, so you're welcome to all of them. If we don't have your details, just sign up. You can leave your email on your referral cards. We'll add you to our mailing list. You'll always be the very first to know, the very first to get a spot, because we do sometimes sell out, so it's definitely the best way to reserve your space. But thank you. Have a wonderful start to 2023. Happy New Year, and I hope to see you again really soon. Thank you.
Thank you.
Bye.
Thank you.
Thank you.